everyone, I'd like to welcome today's guest. Her name's Dr. Lipartia. She's a double board certified physician in internal and obesity medicine and a clinical fellow at Boston Medical Center in Massachusetts. Hi Marine, how are you?
Great, thank you Sophie. It's my pleasure to be here. Thank you for inviting.
Of course, I'm very excited to hear your insights today. So for people who aren't already familiar with yourself and your work, can you just talk a little bit about your background and what your specialty is in medicine?
Thank you. I'm trained in internal medicine, and since graduating my residency for more than 10 years ago, I've been practicing hospital medicine. And that's during that time that I encountered a lot of complications and adverse effects of unhealthy weight and poor nutrition. So last few years I started delving and self-studying and devoting a lot of time to understanding science and physiology of nutrition, obesity medicine. That led me to board certification. But after becoming board certified, I wanted to get even more deeper understanding of the science and get more experience and work with world leaders in the field and get experience from them. So I joined the clinical fellowship in nutrition and obesity medicine at Boston Medical Center, where I am now. It's mostly clinical practice in outpatient and inpatient, taking care of patients with malnutrition, obesity, and also doing some research around those topics. So.
That's great. And how long have you been in this field? When did you start out?
So officially in fellowship, I started last year. I became board certified a year before that, and then I've been doing some self-study for a few years.
That's great. It's great to have you here. So in relation to your field of study and your line of work, thinking about the current pandemic and some of the struggles that people might be facing right now with regards to their health and well-being, what kind of challenges do you think people are facing at the moment? What kind of things have you been seeing or hearing about in your community?
Thank you. That's a great question. There are few as I think, and I've been talking with a lot of patients and family and friends. It's very challenging time as related to nutrition and obesity part. So everyone is at home. There's no structure. The stress level is very high. So that's perfect storm for stress eating. And stress eating, for some, it means undernutrition. For some, it's overeating. So that really leads to poor nutrition and adverse health outcomes. There is nutrition, there is decreased physical activity because of being at home all the time, gyms closed. Some people are afraid to go and even walk outside for a good reason. So that all adds up, but I don't want to it sound like that it's just eating more and moving less is what's necessarily just going to lead to obesity, because that's very complex medical disease. And when I talk to people, I think the most challenging part I encounter is I hear, this is not the time to worry about my health in terms of nutrition. This is not the time to worry about my weight. I'm just going to pause my weight loss journey. And I think that's where the biggest challenge is, because people look at it as treating obesity as something that's luxury. It's a vanity, and it's not. It is a medical condition. It is a disease, and it needs to be treated as such, because we're learning now that obesity is one of the biggest risk factors for severe complications related to COVID-19. So that's the biggest thing that I want people to know.
Yes, and I've been seeing that in my network as well. There's a lot of people who talk about health at every size and being accepting of who you are and where you're at right now. I had a friend of mine posting in a group that I'm in recently. She said, you know, I've just come to accept that I'm going to gain weight and I'm going to lose progress in my health during this time, and I want to be able to accept myself for that and handle that better mentally. And my response was, well, why does that have to be the case? Why can't you decide that this is just as good a time as any to focus on your health and just change your habits and your patterns and try to prioritize that during this time and try to prevent that from being the case? She was very offended by that, and she said, this is not what I was asking, this is triggering me, this is, you know, I don't feel as though that is achievable right now. So for people who are in that mindset, like you said, who are telling themselves like, now's not the time to focus on my health, what do you have to say to that?
Thank you so much for bringing this up. So I think this has also a few layers. One is that, yes, when we talk about obesity as a disease, we are not fat shaming and we're not pointing fingers. We are bringing it up because we're concerned. We want to help these people because we know that excess fat tissue is not healthy it's not good for your health. And I'll talk more about why that's the case. And I think that's also related to how we as a society have stigmatized and fat shamed obesity and people with obesity. So that's probably all related. And, you know, I understand it's very stressful, and it's hard to think about something that you are, for you, sounds like extra and luxury. But if we think of it as disease like diabetes, no one would say that I'm not going to take care of my diabetes now because that's not priority. I don't think, you know, many people would say that. And we should approach obesity the same way.
Mm-hmm. Yeah, I think that's a great perspective. So getting into the second half of our discussion, I'm wondering if you have any practical tips or recommendations or resources that you can share to people who want to improve their health at the moment, or they're finding it challenging. What can they do to try to make the best of the situation and not let things set them back in terms of their health?
Sure. So again, I think first and most important is to understand that this is medical disease. It's not moral failure, the disease of obesity. And why we think it's a big risk factor is because this fat tissue is pro-inflammatory. So obesity is a state of chronic inflammation, and that we think that that's related to why we're seeing more poor outcomes in people with obesity. Now, what we can do in terms of eating, I think one of the things is that if you go to store, you will see that all non-perishable food is gone from shelves because it's so easy to store. They're not buying really fresh fruits and vegetables because they are stocking up. They don't want to go to store frequently. So one of the options is that what I do, in addition to getting fresh fruits and vegetables, and you can store in freezer, you can also buy frozen fresh food and just kind of use it slowly rather than just getting ultra processed food from shelves. Reach out to other people. I think that's more important now than ever. And social distancing does not mean social isolation. We should be distancing physically, but instead of scrolling on Facebook or texting someone, maybe actually call and set up FaceTime, etc. So we're lucky that we have all these technical solutions for those things. Be as active as possible. Even though you are at home, you really don't need any fancy equipment or gym to do a few laps around the house or do squats or whatever is available for you. And there are luckily many apps that now are offering free subscription for at least a few months. There are many yoga, home exercise, meditation apps, and I think everyone should take advantage of those. And I'm also asked frequently what nutritional supplements should I take, what vitamins, etc., etc. And I'll say that good nutrition is very important for good health, but nothing will prevent us from getting infection other than physical distancing, hand washing, not touching our face, etc. So I don't want people to think that, you know, if I eat well and if I take that supplement, it's going to protect me. Nothing will protect, except if you're healthy, the chances that you will overcome this infection with milder forms is, of course, higher.
Yeah, I think there's a lot of tendency for people when they're in like a panicked state to try to find a quick fix or a solution or something. And I've seen all sorts of rumors going around about, oh, if you eat loads of raw garlic, you're not going to get the disease and things like that. And it's understandable why people want to believe that these things are true and they want to try them just in case they work. But I think, like you said, it's about reminding yourself, you know, this virus is contagious, and if I'm coming into contact with people, I might contract it. But, you know, trying to strengthen your immune system, trying to create a state of health so that you could handle that, should that be the case. Just setting yourself up to be in the best possible position to fight that. I think that should be the focus. And like you said, sticking to proven methods and strategies, and looking to the nutritional content of the food that you're eating as well.
That's correct. One thing I want to also add is I think this would be the best time to really nourish yourself the best you can, but would be the worst time to say, I am going to start any fill-in gaps type of diet from tomorrow. Because the diet, that word is always associated with so much restriction that you can't have that, you can't have this. And we already have so much stress due to COVID-19 that I think adding any unnecessary stress is very bad idea. So instead of saying from today or tomorrow or Monday, I'm starting some kind of diet, we should approach and, you know, change wording, say, I'm going to feed myself and nourish myself best I can. I'm going to go to grocery and buy food like if I'm going to pharmacy and getting medications for myself.
Mm-hmm. Yeah. And I was just thinking, sorry, I lost my train of thought. Remind me what you were just saying.
That starting diet and, you know, wording that way would be the worst idea and time probably ever, and especially now during this stress.
Yeah, I think you're totally right, and that because we already have so many restrictions in what we can and can't do, where we can go, what we can buy, so many businesses are not providing the same service that they were. Everything is changing. If you're then imparting this additional strict regime or, you know, additional restrictions, I can't imagine that being good for your mental health. And then even on the practical side, so many things that used to be readily available to us are now not available, or it's unpredictable as to whether the stores are going to have things in stock. So, you know, I can imagine that also being very difficult to adhere to at the moment, given all of the uncertainty in the current situation.
Can't agree more.
Yeah. So are there any other practical suggestions you have, or any resources or websites or books that you can point people to who would like to get a bit more support with this?
Yeah, there are many websites. What I've been using myself and telling everyone around to download, and I don't have any affiliation or financial benefit from that, is Headspace meditation app is free, and they, it does not mean that you're gonna start like 1 hour meditation every day, but I think it's very good way for helpful for many for stress management strategies, and it's completely free for now for everyone. The other there's an app called Down Dog that has yoga and different kind of exercises, and it has 7-minute 10-minute workouts that are very easy to do at home without any equipment, without going outside. So that you can't say I don't have 10 minutes. You may say I don't have 2 hours for workout, but 10 minutes probably kind of eliminates that obstacle. Those are, and many other apps are also free, so just download. But I think the best is to pick up the phone and call your friend, call your relative, neighbor, FaceTime, and socialize. Don't worry alone, and don't feel isolated.
Yeah, and I think from what I've heard, and I used to be a dietitian, and one of the things that we used to recommend to patients is to, when you're having these cravings to eat, stop and think to yourself, is this because I'm hungry? Is this because I am lacking nutrition? Or is this trying to fill some kind of emotional void that I'm feeling right now? And so I think having that self-awareness of when that's happening, that's the ideal time to, like you said, reach out to somebody to have a call, or try out an exercise in an app, or do a meditation, and just fill your time with something that is just occupying your mind and your body and just keeping you busy.
Absolutely. That's such a huge topic, cravings and how to avoid eating from boredom, and eating when you're not hungry. It's a huge topic, but definitely when you are alone, getting to that is so much easier, and so hard to really stay away from any bad habit, including eating when you're not hungry. And it's hard when you're stressed out and feeling alone. Just thinking through that, even pausing for 2 seconds, may be hard. And sometimes I find this mini meditations and mindfulness, just taking few deep breaths before reaching for something, really helpful. But I'm sure will not work for everyone, but it's just one of the tools.
Yeah, I think it's just that interruption of the thought process. Just instead of just going straight into the habit behavior, it's just trying to sort of question, is this the best thing for my health right now? Is there something else that I might be able to try? Not having, enormous expectations for yourself, like starting huge new programs or,
right.
Things like that, but just thinking, even on a daily basis, what could I do to just put my health as a priority right now?
Yeah, it could be as simple, and even though it's not really simple, as just drinking a cup of water before eating, and that kind of will make you pause, really rethink if you're really hungry or not, and you may not even want to eat, or if you drink a cup or two of water, or just stop and take a couple of deep breaths. The other thing I've been telling everyone to, as we're working from home, try, if available, and not everyone may have that at home setup, but don't set up your working station in the kitchen, and just don't be in the kitchen all the time. So small things like that may go a long way. really having structured time as much as possible at home, having breakfast, lunch, and dinner time, and not just because we're home snacking all the time. Those are some specific things, and different things will work for different people, but there are many tools in the box.
Well, thank you so much, Maureen, for sharing everything. I'm sure that people will be able to implement a lot of the tips that you've recommended. So thank you for being on the series.
Thank you, Sophie. It's my pleasure. I really appreciate you inviting me here.